Thank you for choosing Crystal Clinic for your upcoming surgery. My name is Stacy Fry, and as a patient here myself, I can assure you that you have made the right choice. You will receive the highest level of care. As a hospital specializing in orthopedic, musculoskeletal, and reconstructive care, Crystal Clinic is here to help you recover more quickly and get you back to the activities that you enjoy. Through this video, I will help you understand what to expect before, during, and after your surgery. We believe that the more you learn, the more you'll be empowered and the better your outcome will be. By the way, it is also recommended that you have a family member or a friend available to help you at home, someone we call a coach, for at least a week after your surgery. First, let's cover what your upcoming surgical experience will be like. We will share what you can expect in the hospital for your surgery and explain what your rehabilitation team will teach you for a safe return home. We'll also talk about how you will need to prepare yourself, your coach, and your home for care following surgery. The best place to start is to prepare your home for when you return from your surgery. Remove any tripping hazards such as all throw rugs. Make sure anything you may need is up on a counter instead of on the floor so you can avoid bending and lifting. Your surgeon and therapist will review your activity restrictions with you following surgery. You may need some special equipment at your home to help with your post-surgery recovery. For instance, if you have a hip, spine, or knee surgery, you may need a walker temporarily to get around safely. Obtain any equipment you'll need during your pre-op visit or prior to your surgery date. You can purchase or rent this equipment through a medical equipment vendor of your choice prior to your day of surgery. Then be sure to bring the equipment with you on the day of your surgery. For orthopedic procedures, you should know that swelling is a normal reaction after surgery, and more swelling means more pain. Using a cooling unit or ice packs will help considerably to reduce the swelling and pain. If you bring your own cooling unit with you, it will be applied immediately following surgery in the recovery area. If you don't have a cooling unit, Crystal Clinic will provide ice bags to help cool your surgically repaired area. Cooling the surgical area will continue throughout your stay and is recommended for a period of days once you're back home. For orthopedic patients, your therapist or physician may recommend that you participate in a pre-operative physical therapy evaluation. There, your therapist will evaluate your current ability and function and educate you and your coach about precautions and post-op care. You'll also get a list of exercises that can help prepare you for the best outcome. If you are referred for pre-operative physical therapy, your therapist will demonstrate any required post-operative exercises in further detail. If you are currently in therapy for your joint, continue doing the exercises prescribed to you. That will improve the outcomes and benefit your rehabilitation after surgery. You can have this assessment performed at any Crystal Clinic physical therapy location. The goal is to get you back to normal in your routine as soon as possible after your surgery. To accomplish this, Crystal Clinic encourages the practice of wellness dressing. It's a simple but empowering step. By wearing your regular clothes, you naturally begin to mentally focus on becoming healthier and stronger. With this in mind, if you're having inpatient surgery and will be staying at the hospital, please pack 2 or 3 sets of loose-fitting clothes, including elastic waistband pants that aren't too restrictive at the hip or knee, comfortable walking shoes with rubber soles, no flip-flops or anything backless, a hygiene or cosmetic bag, any educational materials that were provided during therapy sessions or by your physician's office, magazines, books, or any device you use regularly, like a smartphone or iPad. Do not forget the charger. Bring your CPAP machine if you use one, and be sure to bring the new or used but clean cooling unit if you purchase one. You also want to bring these important documents with you to the hospital. Have your insurance cards, bring your advance directive, living will, and durable power of attorney if you have them. And don't forget to bring your medication list. Now that you know what to bring, it's also important to know what to leave behind. Please leave all valuable items such as earrings, rings, money, watches, necklaces, bracelets, and other precious items at home. The night before surgery, there are a few things you must do to help prevent infection. Put clean linens on your bed. Take a shower as the last thing you do before you go to bed, using an antibacterial soap or a particular soap recommended by your surgeon. Make sure you wash with a clean washcloth, paying special attention to the part of your body where the surgical procedure will take place, what we call the surgical area. When you get out of the shower, use a clean towel to dry yourself. Put on clean pajamas, and in the morning, dress in clean, comfortable clothing. Clean is the theme. Anything that touches your body before surgery, especially near the surgical area, must be freshly laundered. As an additional precaution to help prevent infection, you'll be given an antibiotic at the hospital on the day of your surgery. When you arrive at the hospital on the day of the surgery, go to the registration desk. There, staff will review your personal information and provide guidance. If you are having outpatient surgery and not staying the night at the hospital after registration, you will go to the same day surgery area where you'll be prepared for surgery. Your surgeon will see you before surgery and physically mark the surgical spot on your body with a marker. You will also speak with an anesthesiologist to discuss the anesthesia that will be used for your surgery. After surgery, you will recover in the recovery room, also known as the post-anesthesia care unit, or PACU. You will stay there for at least an hour and possibly longer while the staff monitors your recovery. During this time, the PACU nursing staff will be keeping a close eye on your vital signs such as heart rate and blood pressure. In recovery and throughout your hospital stay, your pain level will be monitored by asking you to rate the level of pain you're experiencing at the time. Pain is measured on a 0 to 10 scale, with 0 being no pain, 10 representing the worst pain you can imagine. Staff will work with you and your surgeon to keep you as comfortable as possible during your stay. While they can't make you pain-free, the goal is to keep you at a low to moderate pain level between a 3 and 5. Once you're doing well and waking up easily, you'll be moved from the PACU into your room. Once you've settled into your hospital room, you'll meet your nurse. Your nurse will take your vital signs, complete a neurological assessment, and listen to your heart, lungs, and stomach. They'll also orient you to your room and assess your pain level. Your nurse will inform you of any pain medication your doctor has ordered and the next time you're due to take it. Remember, your pain medication is ordered as needed, so be sure to request it when you feel you require it. To reach your nurse for any assistance, a call button is located at the side of your bed. It is the big red button at the top of the patient communications device. Please know that your well-being and safety is the primary concern. Your nurse will review your call, don't fall agreement with you. In other words, you assure the nursing staff that you will always ask for help when you're getting out of bed. You'll be attached to devices such as IVs, pneumatic cuffs, and ice machines that can make it very difficult to get up safely without assistance. So please always ask for help. And remember, call, don't fall. To keep your lungs healthy after surgery and prevent pneumonia, your physician will require you to use a spirometer, along with coughing and deep breathing exercises every hour while you're awake. The objective is to increase your lung volume during the course of your visit. Your nurse will review this with you during the admission to your room. Your physician will have you start with a clear liquid diet following surgery. Shortly after arriving to your room, you'll receive a clear liquid diet tray with soup broth, Jell-O, lemon ice, and hot tea. Provided you can tolerate the clear liquids, you may be able to advance to solid foods and order from a menu. Don't be surprised if your bowel movements are delayed a day or so. It's quite normal. It occurs since you haven't eaten or had much movement, and constipation is also a side effect of pain medications. During your pre-admission testing appointment, the nurse will suggest some over-the-counter medications that may help with this after you get home. The nursing staff will make rounds about every hour during waking hours and about every 2 hours during the night. As already mentioned, staff will regularly ask you to rate your pain and will ask if you need assistance with changing your position, if you need to use the bathroom, and if you can easily reach your possessions. They will try to anticipate your every need, ensure your safety, and do everything possible to help you have a positive experience. As a key part of your recovery, therapy and nursing staff will encourage you to get up and start moving. The day of surgery, your therapist will spend time with you, reviewing your exercises for circulation. Your therapist will also make sure that you and your coach understand all aspects of the rehabilitation your surgeon has prescribed and assist you with other aspects in preparation for going home. This includes safety tips for navigating into and out of your bed, walking with the devices needed, getting into and out of your car, navigating stairs, and other daily activities and self-care such as bathing and dressing. Your therapist wants to make certain that you and your coach are prepared for a safe and productive transition home. After you're home, it's important for you to continue with your exercises you learned from your therapist. You're encouraged to get up and walk at home to increase circulation and blood flow throughout your body. A gentle walking program on flat surfaces, up to 3 walks per day for about 10 minutes each, will help you feel better and will promote healing. When you are discharged, your nurse will review your incisional care instructions as determined by your surgeon. You can reference your surgeon's protocol for a complete list of activities you should refrain from doing. You may need your coach to assist you with bathing, dressing, exercises, and certain household activities. You'll be instructed about any restrictions that are ordered by your surgeon. For your safety and to promote faster recovery, you'll need to meet specific discharge criteria in order to leave the hospital. Your therapist and nurse will make sure you complete all your therapy appropriately so you'll feel confident about managing your own care safely at home. Additionally, the staff will make sure you have medical clearance, the prescriptions you need, and any therapy or nursing arrangements made prior to leaving. If you were provided educational materials or booklets by your surgeon or their office staff, please take time to read through those thoroughly. Note any questions you have. Hospital staff will be happy to answer your questions once you are on site. Here's a recap of the list of items you should pack for your hospital stay. Bring clean, loose-fitting clothing, comfortable, rubber-soled walking shoes. Remember, no flip-flops or backless shoes. Your hygiene or cosmetic bag, your photo ID, insurance cards, updated medication list, and all documentation from your doctor's appointments. Your CPAP device, if you need one, a cooling machine, if you have one, any brace or sling or walking device you will ultimately be using at home, such as a 2-wheeled walker. You can also bring books, magazines, or devices you use on a regular basis, such as a smartphone, iPad, laptop, all along with their chargers. Thank you again for entrusting Crystal Clinic for your surgery. We do hope that you found this education video to be informative and helpful in answering any questions you may have. Through education and communication, your procedure will go smoothly. Of course, let your physicians, nurses, therapists know if you have any questions about your upcoming procedure. They are all here to answer your questions, ensure your successful surgery, and promote a quick and healthy recovery. We wish you well and look forward to seeing you get back to doing the activities you love.